Hi, today I'll be talking to you about pseudoephedrine and phenylpropylamine and the effect they have on the oxygen carrying capacity of blood during exercise. The question I'll be focusing on today is the effect of pseudoephedrine and phenylpropylamine on the oxygen carrying capacity of blood and their effect on exercise performance. Firstly, I will be talking to you about the structure of both chemicals. Pseudoephedrine is a sympathomimetic drug that belongs to both the phenylethylamine and amphetamine classes. It can also be referred to by its systematic name 2-methylamino-1-phenylpropan-1-ol. It is important to note that the function of this chemical is based on its structure and the way it relates to other structures of other chemicals. On the other hand, phenylpropylamine is a psychoactive drug of the phenylethylamine and amphetamine classes. This drug can also be referred to by its systematic name 2-amino-1-phenylpropan-1-ol, and once again, its structure is based on its function and its relationship to other chemicals. Pseudoephedrine acts directly on adrenergic receptors throughout the body. Adrenergic receptors are a class of G protein coupled receptors that are targets of catecholamines and drugs like pseudoephedrine. More specifically, pseudoephedrine acts on alpha-1 adrenergic receptors to cause vasoconstriction of blood vessels, as can be seen in the image. Vasoconstriction is caused by the muscles lining the blood vessels contracting. When pseudoephedrine acts on beta-2 receptors, however, this causes relaxation of smooth muscles lining the respiratory tract, as can also be seen in the image. There is vasoconstriction and vasodilation, bronchoconstriction and bronchodilation. On the other hand, phenylpropylamine acts as an agonistic receptor on alpha-adrenergic, beta-adrenergic, and dopamine receptor D1. In other words, this drug acts on the fight or flight division of the sympathetic nervous system, causing an increase in heart rate and blood pressure, and increasing energy and sweat production. As can be seen in the image, arousal of the sympathetic nervous system causes an increase in heart rate and an increase in sweat production. Because of their effects on the body, these two drugs have been banned by the World Anti-Doping Agency. For example, Romanian gymnast Andrea Raducan had her gold medals taken from her due to pseudoephedrine being detected in her urine whilst she competed in the 2000 Sydney Olympics. It is important to be aware, however, that the same dose of these drugs can have a different effect on the individual and can show up as different concentrations within the urine of each individual. In other words, the effects of the drug are different for each individual. A study conducted by Swain et al. 1997 had a placebo-controlled randomized double study to determine the effect, if any, these two drugs had on exercise performance. The main factors that were measured throughout this experiment was the maximum oxygen uptake, commonly known as the VO2 max, time to exhaustion, peak blood and pulse pressures, and the urine concentrations of these two drugs. The subjects of this study were 20 healthy male cyclists who on average cycled 50 miles per week. They had no known health conditions and were not taking any prescribed or non-prescribed medications. The results generated by this study has shown that there are no benefits on exercise associated with the consumption of these drugs. Throughout the study, each subject consumed 0.33 milligrams per kilo of body weight of phenylpropylamine, and subjects even consumed double this dose with no recognizable benefits. Pseudoephedrine was given to subjects in both 1 milligram per body weight and 2 milligram per body weight forms. Both these forms had no benefits on oxygen uptake or time to exhaustion during exercise performance. However, although the results of this study do not support the theory that these two drugs have a positive effect on exercise performance, it is important to remember Maybe when these two drugs are administered in higher concentrations, they will bring out a positive effect on exercise. A study conducted by Pritchard-Peshek et al. 2013 revealed consistent results with Swang et al. 1997 that no known benefits were identified by consuming these two drugs. However, Pritchard-Peshek and his fellow researchers believe that a possible explanation as to why no benefits are being seen with pseudoephedrine and phenylpropanolamine is because it requires between 30 and 120 minutes to reach optimal concentrations in the blood. However, when researchers measure its concentration, they do so almost immediately after oral ingestion, meaning not enough time is given for the full effect of these drugs to take place on the body. An interesting study conducted by Gill et al. 2000 has shown pseudoephedrine to have a positive effect on participating subjects. For instance, it was noted that a greater degree of muscle activation during knee extensions occurred 2 hours after ingesting 120 milligrams of pseudoephedrine. This effect is believed to be brought about due to the effects amphetamines exert on muscle cells. Pseudoephedrine is believed to lead to a greater recruitment of motor units, allowing muscles to contract with a greater force. Therefore, an increase in heart rate which results from ingesting this drug would most likely result from increased sympathetic nervous system activation, leading to increased contractile force of the cardiac muscle tissue. Furthermore, Gill et al. 2000 found there to be a positive correlation between pseudoephedrine ingestion and lung function when compared to controlled subjects. Subjects who consumed pseudoephedrine were able to expire more air and inspire more air on each inhalation. This is a result of pseudoephedrine activating the sympathetic nervous system and causing bronchodilation, dilation of the bronchioles. As can be seen in the image, when the bronchioles are dilated, air is able to enter more readily into the lungs and exit the lungs more readily. On the contrary, however, a study performed by Salerno et al. 2005 showed phenylpropanolamine to have a positive effect on both the systolic and diastolic blood pressure of healthy, fit individuals. No effect on pulse was noted. However, a very important factor that was noted was the effect of phenylpropanolamine had on the body based on whether it was released immediately into the bloodstream or was a sustained release formula. Immediate release had a greater effect on both diastolic and systolic values in comparison to sustained release. The systolic blood pressure increased by 5.9 millimeters of mercury with immediate release and just 5.3 millimeters of mercury with sustained release. On the other hand, with diastolic blood pressure, it increased by 6.8 millimeters of mercury with immediate release when compared to just 2.8 millimeters of mercury with sustained release. In conclusion, it is important to note that the effects these drugs take on the body varies between individual and between study to study. Thank you for listening.